Hi, my name is Rita Atwell, and I will be presenting my 2019 GGF Veteran Leadership Program proposal on Conakry, Guinea, a fresh waste management project. The level of concerns are high. The situation requires both the policymakers and the community working together to create an environmental, climate-controlled waste management program. My three initiatives. My motivations are twofold: to generate entrepreneurial job creation opportunities and to clean up the environment. My missions and objectives are to establish contact and partnerships for funding for African countries with serious environmental hazards. And three, there are many reasons for my interest in this project, but I am personally vested with transforming this community. My family resides in Guinea. My dream is to open doors for business ownership and employment possibilities, and to bring the need for an ecologically sustainable garbage-free environment into focus. Guinea, officially the Republic of Guinea, is one of the beautiful countries on the western coast of Africa, formerly known as French Guinea. A waste management program has not been implemented. A water management program has been implemented. However, trash is thrown about, uploaded everywhere in Conakry. Though the primary concern in this report is waste management, poor health conditions are the direct result of improper garbage disposal methods. Burning trash is the main method to destroy trash in West Africa. The Department of Natural Resources in Wisconsin noted, open burning results in ash particulates just floating in the atmosphere and can damage the lungs, cause bronchitis, emphysema, and lung cancer, among other diseases. Further, burn sites vary. Emissions when burning different materials together, releasing poisonous gases, dioxins, ash, carbon monoxide, lead, carbon dioxide, sulfur dioxide, arsenic, or mercury. Also, because the emissions concentrate close to the ground, this creates a greater health risk of direct exposure to harmful pollutants. The closer you stand to the burn site, the more of these chemicals you may inhale. This is a picture of a street leading directly from and to the airport in the capital and largest city of Guinea. Here, there are no rules to what is dumped, and because of the volume of garbage dumped, there is usually a plume of smoke active, where there are people who just keep it burning to cut down on the massive piles that can accumulate. Waste collection can provide many important services to the community. Conakry, Guinea, as other African countries, must begin to engage in a more assertive way to manage the solid waste process. The European Union funded a research project in 2014. The research resulted with a blueprint for establishing a waste management program guide for Western African countries. This project addressed inadequate waste collection services and recycling systems, hazardous dumps, and environmental damage, resulting in risk to health, impacting the lives of millions of Africans. According to a 2015 country status report on health and poverty, the life expectancy of Guinean residents is 70 years of age. However, the report forecasts a healthy expectancy in both sexes to be 9 years lower than their overall life expectancy at birth. This simply means that though most residents could expect to live until they're 70 years of age, it will probably not be realized due to a loss of almost 10 years due to conditions of inadequate and deficient environmental health conditions. This chart is from the same report, and it shows, among other important facts, that if a person was inflicted with some of the mortality risks throughout their life expectancy range, that they most likely will not reach their exact life expectancy, prospective ages, and will die early. This chart shows the probability of dying statistics for persons between the age 30 and 70 from the four main NCDs: cancers, diabetes, cardiovascular diseases, and chronic respiratory diseases. This relates to the waste management program because there's a toxic environment that is realized when there are uncontrolled waste disposal sites. The bottom of the page shows some of the areas that the national systems deem important to report on regarding the NCDs. However, there is no correlation between NCD diseases and the present trash disposal methods. Surely, public health officials should be looking at the combination of water and waste to better combat the effects toxic particulates can have when the waterways become runoff dumping grounds from the waste. My business goal number 1 is to establish a communications network with major players. My business goal number 2 are the mapping objectives. As a means of improving the living and health conditions of Guineans while protecting the environment, assisting the development of appropriate waste management policies and implementation strategies specific to Conakry, Guinea, on 3 levels: the national level, the regional level, and the local level. My business goal number 3 is to locate funding, investor opportunities, international resources. EU Waste Control Bulletin for Success consists of practical steps countries and regions in Western Africa can take to design and implement an integrated waste management system for their local communities. The blueprint includes recommendations on training, waste reduction, collection, sorting, recovery, reuse, and recycling of valuable materials and disposal methods. This chart shows the 7 stages that I suggested to get the ball rolling to develop an effective waste management program. Results: partnering with the global community, promote the importance of community stakeholder involvement, promote the empowering of entrepreneur initiatives, and provide education to the community to become involved and self-reliant on ways they can immediately improve their own environmental conditions. The end. Thank you.